Looking at the temporal bone, we're going to notice the temporal bone here is everything in orange. You can see that's part of this ridge coming forward into the cheek. Going up into the skull here, that green is the parietal bone. You can see coming back here, the yellow is a occipital bone. And you have this spike down here. This gray is going to be the mandible, which is your jaw. What you do is change out the normal skull so you can look at all the landmarks we have for the temporal bone. Now that we have the normal skull out, we can still see the temporal bone is all this section here. But one thing you can keep in mind, I'll move this a little down here, is you can still see parts of the parietal bone. You can still see the occipital bone back here. This is the frontal bone. So a lot of different parts and pieces are still present. So if we start with the landmarks, first thing up is the zygomatic arch. Now, this one's unique because this term actually spans across two different bones. The zygomatic arch is this ridge out here. It's pretty much what goes just in front or anterior to your ear, that ridge of bone that goes forward into your cheek and just under the eye orbit. It's the temporal bone, this portion, but notice there's a little line right here. That's a suture signifying a different bone. This bone is the zygomatic bone. We'll talk more about that later. But for this point, zygomatic arch is this whole thing. So it's this process, part of the temporal bone, and this portion, part of the zygomatic bone. So the zygomatic arch is this whole thing going across two bones. Now the portion that's right here, the one that's on just the temporal bone, this is called the zygomatic process. You're saying, hold on, zygomatic process, it's on the temporal bone. True, zygomatic process because it goes towards and into the zygomatic bone, but it's the zygomatic process. So the whole thing, zygomatic arch, just the temporal bone portion, zygomatic process. All right, next thing up is the carotid foramen or carotid canal. To do that, we have to change orientation though. For this orientation, we're looking at an inferior view. To try and orientate a little bit, what you're seeing, this portion up front, this is the jaw. So this is the anterior portion up here. You're seeing this hole, that's the foramen magnum. We talked about that in a previous video. This is the posterior portion. So anterior is on this side, posterior is on this side. We're looking for the carotid foramen or carotid canal. Now, on most of the plastic skulls, a lot of times the carotid does not go all the way through. This indent right here is the carotid canal, or known as the carotid foramen. It is going to be just usually anterior to this opening, which is going to be your jugular foramen. Notice the jugular foramen is kind of an unusual shape. It's not perfectly round. So that is the jugular foramen. Carotid canal or carotid foramen is just anterior to that. We then have the mastoid process. That's this piece right here. Now the mastoid process we'll look at also from a lateral view. All right, now I've reset. We're looking again from my lateral view. This is anterior, this is the face. This is posterior, back of the skull. That mastoid process is right here. You can see how it's a large bump that comes down. If you feel just behind or just posterior to your ear, that bump of bone in the back, that's your mastoid process. And that mastoid process contains mastoid air cells. So inside of this are mastoid air cells. Now if we go just anterior, we're back up here. This is the zygomatic process, the whole thing, zygomatic arch. But I want to point out, see this little bump right here, this little bump coming down. That is the articular tubercle. It's just on the inferior portion of the zygomatic arch, so the articular tubercle. Then if we look just a little bit behind that, our posterior, we have this area. This area right here is the temporal mandibular joint. Temporal bone, mandible, which is your jaw. So temporal mandibular joint is where these two bones come together and make a joint. That's the temporal mandibular joint. Now the mandibular fossa is where that's sitting. So I'm going to have to take the jaw and basically dislocate the jaw. So I'll get that all set. You notice now I have taken the jaw and pulled it out of the joint. This is the top of the jaw. That indent is where it was sitting. That indent is going to be your mandibular fossa. The mandibular fossa is where the mandible sits. So we put it back in. Now that's back in place, you can see how the mandible, this part down here, is inserted into the mandibular fossa. It's basically sitting in the mandibular fossa. So the overall mandible, which is this bone here, the bone sits in the mandibular fossa. We also then have the external auditory meatus. External auditory meatus, or known as the external auditory canal, or known as the external acoustic meatus, also known as the external acoustic canal. You get the point, there's a lot of names here. The idea is, though, the external auditory meatus is this opening right here. It's just posterior to the temporal mandibular joint, just anterior to the mastoid process. That is going to be your external auditory meatus. Basically, that's your ear. That's the opening that your ear goes into your skull. The external auditory meatus. Now, there is an internal auditory meatus, but to see that, we look inside the skull. So let's reorientate. All right, this is now looking inside the skull. To give you orientation, this is going to be the anterior. You can see frontal bone, you can see ethmoid bone. This is posterior, foramen magnum. What we're looking at, that little opening right there. So you can see there's this kind of bulge in the bone. There's an opening in there. That's the internal auditory meatus. Internal auditory meatus. Which brings us up to the styloid process. So we've got to turn things around. Now that we have our orientation, you can see this is the anterior side over here, posterior side back here. We need to look for the styloid process. This point right here is the styloid process. The styloid process is just going to be a little bit towards the middle, so medial, and anterior to the mastoid process. So this spike here is the styloid process. Now, if I kind of turn things a little bit, you'll notice it's hiding behind the mandible, but if we rotate a little bit from a posterior view, it's easier to see. There's a little easier to see from the posterior view there. But what we also need to find now is the stylomastoid foramen. Like the name implies, styloid, mastoid. So stylomastoid foramen is visible in between the two. Here's the styloid process. Here's the mastoid process. That little hole right there is the stylomastoid foramen. So the name tells you it's in between the two pieces, between the styloid process, mastoid process, stylomastoid foramen. So that is your temporal bone. So from a lateral view, this is your temporal bone going in here. So the temporal bone.